I would like to request Dr. Harsha Singh, Consultant Palliative KMCH, to give a talk on critical life care.
Respected dignitaries, elders, and all the students here, today's topic is about critical life care and chronic pain. Elders Day reminds us to honor our services and addresses the challenges they face in health and their well-being. So critical life care ensures dignity, comfort, quality of life for older adults with all the serious illnesses. So chronic pain is one of the most common but yet neglected problem in the elderly after affecting the daily living. So with timely care, compassion, and support, we can reduce suffering and bring back joy to their lives. A quick introduction and demographic overview. It is said that by 2050, India's elderly population with this rapidly increase will project to reach 347 million. And the economical vulnerability is as such that only 29% of the elderly, they receive the pensions, leaving most of them financially insecure and dependent on limited resources. So hence, the policy and support needs are also very limited to address the challenges of India's growing aging population. Current scenario in India, 2% of the population has access to palliative care and geriatric palliative care services, which is mostly concentrating on the metros like Delhi, Mumbai, Chennai, Bangalore, Kochi. Hence, integration challenges and geriatric care is often introduced late and used in either cancer or terminal illness, but as not a part of the routine care. If we look into the pain and the prevalence of the chronic diseases, the chronic disease burden says 21% of India's elderly suffer from at least one of the chronic condition, impacting their quality of life. Hypertension and diabetes constitute 68% of the chronic diseases, and multimorbidity and socioeconomic impact shows that 23% experiences in which women are more affected. What is chronic pain? Pain lasting more than 3 months, common in joints, back, knees, neck and shoulder, either diabetic nerve pain, or just like an unwanted guest who never leaves. Why does happen only in old age? It can be sometimes just a free gift of old age, wearing and tearing of joints, old injuries, and like Dr. Vishnu mentioned, diseases like arthritis, diabetes, nervous issues, etc. Why talk about pain in the elderly? Pain affects many older adults, and still it is being neglected, unnoticed, untreated, impacting their daily life. How does it impact on daily life? That in pain, in seniors, most of them it affects the movement, the sleep, the mood, and overall quality of life. And there's a very misconception about aging, which says that pain is underreported because it is generally seen as normal part of aging, which is not true. So importance of pain management focuses on seniors' comfort, well-being, and independence. Is pain a normal part of aging? Pain is often mistaken as an inevitable part of aging, but this belief is incorrect. Importance of pain management is important for the older adults to maintain good quality of life without unnecessary suffering. And education for seniors and the caregivers, including the family members, help encouraging the timely treatment and reduces silent suffering. The myth says only medicines work and pain is normal in old age, which is not true. Many treatments and lifestyles can also help to improvise the quality of life. It can help into the mobility limitations. It will definitely help into the emotional and mental effects, because the pain leads to chronic poor sleep, depression, anxiety, and reduced energy levels. The social withdrawals, which is one of the most impact from the pain, which causes avoidance of the social activities, resulting in isolation and loneliness. Why is the pain untreated and there's unverbal communication? It's because earlier there were attached families and the detached bathrooms. And these days, we see detached families and attached bathrooms. One of the major reasons we see why the pain goes unnoticed and unreported. So reluctance to report pain is one of the main reasons, which is untreated. Communication challenges, concerns about medication, and importance of supportive care, where caregivers mostly must foster about communication and observe pain signs to improve seniors' quality of life. How to recognize non-verbal signs of pain? Pain expressions, the facial pain grimaces, or even the frowning can signal pain in individuals unable to verbalize the discomfort. Behavioral changes, which are one of the major causes of the pain, like agitation or withdrawal of the basic behavioral signs, can talk a lot about the pain. Physical or verbal cues, just like vague statements like, "I'm just tired." Tired for to perform the activities of daily livings of life. And importance of early detection, observing non-verbal signs and asking them questions, enabling timely pain intervention and control. There are many ways to tackle the pain, which includes non-pharmacological and pharmacological options. That is, without the medications, non-drug pain relief like exercises, massages, relaxation techniques, hot and cold therapy, which is being used, can be saved usually. Cautious medication uses in older adults, which can, with low doses and monitoring side effects. Balanced pain management, combining both drug, non-drug and drug strategies. Even the good footwear and posture also helps sometimes to relieve the pain. Medicines, painkillers can be helped if used under cautious and with the help of the primary consultant. Don't copy neighbors' medications is one of the takeaway points for all the seniors and the friends here. Importance of a team-based approach is very important in pain relief. Collaborative roles play an important role. Doctors, nurses, physiotherapists, and caregivers, we bring unique skills to provide complete management for the patient and the caregiver. Effective communication, detailed counseling does help the members in ensuring consistent and responsive care plans. Family involvements, which includes daily support and to observe behavioral changes essential for the patient care, and a holistic pain management, a goal care plan has been made to address the physical pain and supporting emotional and social well-being. Role and family and support is very important because encouragement from the family, from the social group, from the community activities is very important to provide a complete total pain. When to see a doctor? When there's pain with swelling, fever or weakness, when the pain is severely increasing and pain interfering with daily activities. So, simple takeaways from the discussion today. Pain is not normal with the aging. It cannot be accepted as inevitable part of aging. It should be treated and recognized at the early signs. Tailored treatment approaches are done, combining drug and non-drug treatments, personalized to the individual needs to better pain relief. Identifying verbal and non-verbal signs, which is crucial for early and effective intervention in older adults, and team-based care importance for the family members for a complete support. KMCH initiatives, we have recently combined palliative care and geriatric care services at KMCH Ramnagar. It is a detailed services provided at outpatient, inpatient, respite care, which also hosts supervised short stays to support family givers with flexible duration from days to weeks. Rehabilitation such as physiotherapy, occupational therapy, mobility aids, assessments, speech and swallowing support, and extended telemedicine, which can be also considered as extended OP consultation, where we talk about how to schedule home visits, how to take care of the patients at the home, emergency teleconsults, medication delivery coordination, etc. We focus on clinical excellence, continuity of care, affordability, and family-centered support. And why KMCH? Because multidisciplinary team focuses on with the help of physician, nurses, physiotherapists, social workers. They focus on specialist palliative medicine and geriatric medicine clinic. And we do have an inpatient palliative ward integrated with medical college facilities, which has access to diagnostics, specialty referrals, and emergency support 24/7. So final thoughts, let us work together to make aging not about the pain, but about peace, respect, and meaningful living, because you matter because you're you, and you matter to the end of your life. Thank you.